Well, hi, my name's John Rosenberg, and I am the author of Chapter 9, Early Intervention. I am a senior lecturer in the School of Nursing, Midwifery and Paramedicine at the University of the Sunshine Coast in Queensland, Australia, and I'm also the president of Public Health Palliative Care International. I just want to tell you a bit about this chapter. So, early intervention seems like a fairly straightforward concept, but it's fundamental to health promotion. And so when we're talking about health promoting palliative care, we're talking about preemptive approaches that are going to either mitigate or eliminate what we know is going to happen when people are dealing with the issues around aging, dying, death, bereavement, and caregiving. And that impacts not just on individuals, but on communities as well, and indeed on whole societies. So these are the actions that we put in place so that we can influence these experiences in healthy ways. In public health palliative care, we don't see that dying is incompatible with good health. There are healthy ways to die, there are healthy ways to grieve, and there are healthy ways for communities to engage with the issues around these aspects of life. To structure this particular chapter, I've used the structure provided by Julian and his colleagues in the New Essentials in the New Essentials journal article, and that'll become obvious on the next slide. So in thinking about early intervention, what I've done in this chapter is I've said, okay, we have people who are at the center of care. So not just the individual who has the illness, but that person and their most intimate circle of important people. And they may be a spouse or a parent or an adult child, but the caregiver becomes part of that central unit, that focus for care and for early intervention. In the Circles of Care journal article that, again, Julian and myself and a group of our colleagues co-authored, we provide a picture, if you like, of the different circles that are around a person and their most intimate. Um, uh, sorry, you're going to have to edit that bit. So in Circles of Care, we talk about the people who are closest around the person with the illness, their caregiver, and the people that are closest to them in the care that's being provided. But we need to be thinking about families more broadly than perhaps we do in some parts of the world. So in the West, we talk very much about parents and children and the concept of the nuclear family. But of course, not all families are the same, and not all configurations of families are the same. And so we can view kinship more broadly than simply that of the parents of children at whatever stage during their life trajectory. Equally, it's the social networks that then sit around that center. So we have people who are within the inner circle and the outer circle of social networks, and then we go beyond that. When we talk about early intervention in communities, one of the approaches that I take in this chapter is to talk about death literacy, and this is the capacity of communities to navigate death, dying, grief, and loss. And it requires an approach that brings together the expertise that um, healthcare services and particularly palliative care services have with communities. And the community engagement ladder is a very well established uh, approach to understanding how services and communities can engage. I'm going to talk more about it in a moment, but it's really this idea that it's not simply a matter of delivering services to communities, but it is services and communities coming together in equal partnership. And it becomes very important when we are talking about implementing early intervention strategies into communities because they work best when they are co-created. The Compassionate Communities movement is a really good example of this approach, and I talk about that in this section of the chapter. The next section in that chapter is around early intervention in civic societies. And a really fundamental point here is that public policies are not just for the majority, but they're for underserved groups as well. And I explore some of those groups and how engagement with them becomes critical to um, the life of a civic society, particularly when dealing with issues around death, dying, grief and loss. Alan Kelleher's Compassionate Cities policy vision is a group of 9 vision statements that really explain and explore this in a lot of detail, and I make reference to those as well. And then in the fourth area in the chapter, I talk about early intervention in health and social services. And this is again where the community engagement ladder comes back as a really critical way of understanding that it's not simply about what services do to or with communities, but a real shift in power, because a deeper understanding and orientation towards communities brings with it a corresponding relinquishment of control. Services who actually have the expertise to bring to this equation of community engagement will by necessity have to relinquish some of that control in order to engage most meaningfully with the communities that it seeks to support through early intervention strategies. So those 4 areas are where I examine the different approaches to early intervention using the structure that comes from the New Essentials article. But finally, I also explore the idea of partnerships, and we talk about equal partnerships and partnerships in health promotion, and it's one of those words that can get thrown around without necessarily being really clear about what we mean by it. Health promotion and public health is filled with the terminology of collaboration, but a partnership, as we would express it in public health palliative care, is where the power of the expert service providers is renegotiated. And you can see on the screen there that I use that quote there. It's about renegotiating the nature of the partnership so that whilst the expertise of palliative care services particularly, but health and social services generally, the expertise that they might have in death, dying, grief and loss and the issues around those uh, are in fact provided, but not as a point of control over communities. So it's the communities who are actually driving the nature of the arrangement with services in order to implement early intervention strategies. In the chapter, I use the partnering cycle, and it's explained in some details there. And I provide some examples that we have from around the world where partnerships in public health palliative care really are explained in more detail and are able to show the ways in which early intervention can have a really positive impact on individuals and communities and societies when dealing with issues around death, dying, grief and loss. So I hope that you enjoy reading the chapter and that you find it really helpful and a valuable addition to our understanding of public health palliative care. Thanks very much.